All right, so we're going to demo oral care for you. I've gathered my supplies. We're doing this as if we're in the resident's bathroom, so everything is right here. We will expect you guys to know where these supplies are and get them yourself. So right here I have a towel that I'm going to use as my barrier. I have another towel that's going to be her clothing protector, and we prefer that you use a towel for that rather than a clothing protector because that's what you're going to be doing in the facility. I have a washcloth, I have gloves, I have her emesis basin, toothbrush, toothpaste, I have a cup for rinsing, and mouthwash if that's what the resident prefers. Okay, so of course I've already washed my hands. I've introduced myself to Ms. Horstman, who's my resident today. Explained what we're doing. I made sure that she's safe, she's in good body alignment. I want her sitting straight up for this, and I want her slouched over. I don't want her choking on anything. All right, so I'm going to go ahead and put my gloves on. And I'm going to turn the water on, get my water for rinsing. Ms. Horstman, are you able to hold this?
Yes.
Okay. And is it okay if I put this barrier over your clothing?
Yes.
Keep your shirt nice and dry.
Thank you.
There you go. Would you like a little bit of mouthwash today?
Yes.
Okay. I'm just going to put a little bit of that in here for you. All right. Would you like me to wet your toothbrush beforehand? Okay. I'm going to put a little dab of toothpaste on here. Don't want to overdo it. All right, so we're going to start in the back and work our way forward. I'm going to make sure that I brush all surfaces. Please do this gently. A lot of people have sensitive gums, especially our residents, and we don't want to hurt them while we're doing this. The whole time I'm doing this, I'm looking in her mouth and, you know, checking out, see if there's any sores. Please make sure that you really focus on the gum line where the tooth meets the gum, because that's where plaque builds up. So after I've done this for about 2 minutes, I'm going to brush the tongue. I'm going to give you your cup to rinse. Okay. You want some more? Okay. I'm just going to get your mouth there. You got it? Good. Okay, great. Put this in the sink. Okay, and I'm going to take this from you, okay?
Thank you.
Sure. Please make sure you have a plan of where you're going to put your dirty linens. If you're in a facility, you can use a pillowcase for that. You're probably not going to have a linen hamper in the bathroom with you. All right, so I'm going to clean all my supplies up and put them away. I'm going to make sure that I wash that basin with soap and water because it does have spit in it. And then I'm going to take my gloves off and wash my hands. And then I'm going to take care of my resident who's still in the bathroom with me. So if I'm taking you back to your room, make sure you have your call bell. If we're going to activities, I'm going to bring her with me. And that's oral care.